Hi, I'm Stephanie Clough. It is Thursday, April 14th at 21:05, and I will be doing my video submission for the apical pulse, the stool specimen, the sputum specimen, and the urine clean catch specimen. So this is my ID badge. Before I do any of these procedures, I want to make sure to do the 5 universals. So I want to identify the patient by their name and date of birth, identify myself and my title, provide any privacy, cleanse my hands, and explain the procedure, making sure to answer any questions that the patient may have. So the first thing I'm going to do is the apical pulse. I'm going to find the 5th intercostal space and the midclavicular line where they intersect, which is just generally at or below the nipple, which is over the apex of the heart. I'm going to oscillate their heartbeat for 1 minute using a stethoscope, and then I will record my findings. Next thing I'm going to do is the sputum specimen. I am going to explain to the patient that this must come from their lungs. So I'm going to ask them to take 3 deep breaths and then cough hard and spit into the cup, making sure to get any sputum right in there. Replace the sterile cover and send it to the lab. Next thing I'm going to do is the clean catch urine specimen. So I'm going to ask the patient to cleanse their hands. I'm going to ask them to open a couple of moist towelettes, give them the sterile cup to void into, ask them to sit down, separate their labia with their fingers, begin voiding into the toilet, and then midstream I want them to insert the cup, fill the cup to the marked amount, remove the cup, finish voiding into the toilet, take care of themselves, place it generally on the back of the toilet, replace the sterile cap, wash their hands, and I will be in to pick it up after I've donned clean glove to send it to the lab. I am then going to do the stool specimen. I would make sure to explain to the patient about the hat, that it sits on the back of the toilet and is to collect any stool. I want to make sure to explain to him that they may not void or put any paper into this hat, and once they have had a bowel movement into the hat, that they need to call me immediately so I can assess the stool for the color, the odor, consistency, mucus, or blood. And then I'm going to use a tongue press and one of the sample cups, the collection cups, and take a little bit of it, a good portion, and send it to the lab. If it's O&P, it needs to go directly to the lab. Otherwise, it may be picked up by the lab. And making sure that I don clean gloves before I, touch anything like feces or anything like that before I'm collecting any samples. And then before I leave the room, I want to make sure that the patient is in a safe position. Their bed's all the way down to the floor, the side rails are up, they have their call light, they're comfortable in their bed or their chair, however they may be. Ask them if they need anything else and ask them if they have any questions for me. Thank you.